This video is for the terminology of directional preference. I'm going to add at the end of this video, or after I define what directional preference is, the difference between directional preference and centralization. So, directional preference is the clinical phenomenon where a specific direction of repeated movement and or sustained position results in a clinically relevant improvement in either symptoms and or mechanics, though not always the centralization of symptoms. This is essential for classification of derangement syndrome. This person has a directional preference of whatever. Doesn't matter what it is, whatever. Cool. Derangement. Done. That's, very, very, very base level stuff. Directional preference is essential for derangement, though not always centralization of symptoms. So the difference between centralization, which we defined in a previous video, centralization, just really quickly, is where distal pain originating from the spine progressively abolishes distal to proximal. That's centralization. Directional preferences encompasses a broader range of response than centralization. Centralization refers to lasting change in the location, so centralization is referring to location of pain as a result of loading strategies. Loading strategies, location of pain. Directional preference results in a lasting improvement in symptoms and or mechanics, not always a change in pain. So we're thinking movement strategy specific. You can only achieve directional preference with a mechanical examination. All centralizers, so this is a fun little wordplay, I suppose. All centralizers have a directional preference, but not all those who have a directional preference are centralizers. So say that out loud to yourself again. Characteristics common to centralization and directional preference. So they occur in derangement syndrome, and they can occur in both acute and chronic patients. They can occur with repeated movements or sustained postures, most commonly with extension, less common with lateral flexion and flexion, lateral movements and flexion, I suppose, accompanied by improvements in mechanical presentation. They indicate the classification of a derangement, centralization, directional preference, hand in hand. All would basically suggest that the patient has a good or favorable prognosis, and then failure to achieve these in their regard, you're thinking, if you aren't centralizing, if you don't have a direction of preference, in the mechanical diagnosis and therapy world, McKenzie protocol, it's not favorable. So then you start thinking other things like dysfunction, posture, serious spinal pathologies, mechanically unresponsive or inconclusive, etc. So this video specifically was about directional preference and how directional preference and centralization are related.